So I will go ahead and get started. Before we begin, my name is Lauren Jones. I use she, her pronouns, and I'm the Director of Diversity, Equity, and Inclusion here at the School of Public Health at the University of Minnesota. Just want to acknowledge that the room is dark because I closed the blinds and I don't really like fluorescent lighting, but hopefully it's not bothering anyone. I'm not the speaker anyway, so it shouldn't bother you too much. Just doing the intro. So jumping in, I want to acknowledge that the School of Public Health is built on the traditional homelands of the Dakota people. Minnesota comes from the Dakota name for this region, Minnesota Makoche, which loosely translates to the land where the waters reflect the skies. We'll share some concrete resources for supporting our Indigenous relatives in the chat shortly. Also want to point out that closed captioning is available for this event and that you can access that by using the icon in the bottom right corner of your screen. You can also reach out to Sarah Harris, who is providing our tech support today, via the chat to ask questions about accessibility. We'll monitor the chat for questions, as well as share links to our evaluation and information about future justice and public health events. The Justice and Public Health series was started in 2021 as part of the School of Public Health's commitment to justice and anti-racism. We've been hosting monthly events with local and national experts around topics of public health since 2021. The speakers and presentations in this series help us to be grounded in theory and practice, as well as complement the classroom learning that our students experience. We also hope that today's discussion is part of a broader change happening outside of the School of Public Health. If you're interested in staying abreast of other justice and public health events, please be sure to fill out our event evaluation after this and check the box to receive notifications about upcoming events. You can also visit our website at any time, and this event should be recorded. And if it is, it'll be available to view on our website. Now I'm going to introduce our speaker for today. Lisa is a change maker and strategist with years of experience in government, public health, social policy, and movement building. She's a member of the Health Equity Collective, a group of health leaders who are envisioning the future of health justice and addressing systems of oppression in health. She's currently building Turning Tides Collective, a consulting practice that supports organizations with equity strategy and culture change. Please help me welcome Lisa Ramadar.
Thank you, Lauren. Awesome. Hello, everyone. I'm so pleased to be here with you today. I am going to be talking to you today about the abolitionist cost for public health. My talk is entitled Unraveling the Blanket, the Abolitionist Cost for Public Health. And I want to begin by first acknowledging that I am not the first person in the Justice in Public Health series to speak about this topic. Just earlier this year, the School of Public Health welcomed other speakers who offered their own insights on abolition. So the movement for abolition in public health has existed. And so I'm hoping that I'm just going to be building on what others in the series have shared and the work that's going on across the country by public health leaders who are doing this work. I'm coming at it today from my own unique perspective based in my own lived experience. And I hope that what I can offer will complement what's already out there in the field. And so with that, I want to begin with my own personal story. I come to this work every day with the two people on this slide in mind. That's me at around, I want to say age 8 or 9, and my older sibling, who is really one of the biggest influences in my life and one of the reasons that I have come to the work that I do. My sibling has been living with a mental disorder for most of my life. As you can see, he's quite significantly older than I am. And so from a young age, I was witnessing my brother just experience symptoms of anxiety, depression, and sometimes experiencing crises that felt difficult for my mom and me to manage. And so on one night in particular, I remember I might have been about 13 years old. My brother had a crisis and my mom and I left the house and we didn't really know what to do next. And so as we sort of stood outside, we thought, well, we'd want to go to my aunt's house. But we felt a little unsafe in the way that he was behaving that night. And so we thought we should walk to our local precinct and ask for help, ask police if they would just escort us back home. Our goal really was to make sure that we were safe, but also to make sure that my brother wouldn't be harmed at all in the matter. And so we explained to them that what we want is somebody who would just go with us while we grab some things so we can vacate for a couple of nights, but we don't want any arrests and we don't want any harm for my brother. And we were notified by the person who greeted us at the precinct that police does not do that. It was a shock for me and a shock even for my immigrant mom, I think, because really we hadn't interacted with police much before that. And we wondered about this word protect and serve that's in their cause. And so we learned that day, naive as we may have been when we arrived, that really police were never going to protect us in the way that we wanted. And so this experience was really a pivotal moment in my life. I started to ask a lot of questions. First and foremost, what will it take for my family to feel safe? And when I say my family, I don't just mean my mom and me, but I meant my brother too. What is it going to take for him to be safe in the society that we live in, and be able to live with the conditions that he's living with, knowing that he can be taken care of. I also asked questions like, why must I be injured in order to get help? Because one of the things that the police officers told us that night is the only way they can help us is if we went back home, agitated my brother to the point of hurting us, and then called police for help. And so there was a few things happening there. One, that I had to be injured and a victim of violence in order to be helped, which didn't sound very much like help to me. And there was also an assumption of violence. While I agree that my brother was agitated that night and it made me feel a little afraid, it was not necessarily a violent situation at the point that we had left the home. And so it had this question for me, it brought for me this question about assumptions of violence that the police make. It also raised a question about who I call when in crisis, if I want everybody in my family to be safe, and what kinds of support exists for families like mine. And as I've grown older, I've thought about these questions a lot. And I've learned a lot about systems. I've learned a lot of vocabulary I didn't have when I was 13. And one of the things that I've really been reckoning with is the ways that multiple systems were working against my family and me that night. One of those systems is immigration. This is in the 90s. And so we didn't have ICE yet. We had INS, the Immigration and Naturalization Services. And to any immigrant, those were the most frightening letters you could hear. And so as immigrants, we were always concerned about anything that would put us at risk of interaction with INS. We also were poor and we belonged to a single parent household. And if we did anything that incurred a cost, it could really risk our livelihood. My mom might not be able to pay a bill, and that would put us in a pretty delicate situation. And so we were experiencing what comes with poverty and immigration, and intersecting with all of that now was this disability that one member of our family was experiencing. The stigma attached to it would impact his ability to get a job, to complete his education, but also honestly bringing it back to that fear of INS. If he were ever diagnosed and labeled, it could prohibit his opportunities as a green card holder to ever secure citizenship or naturalization. And so we were encountering all of these systems, and policing was very much a part of some of these systems, and especially in the INS situation, and with the fears that we might, if we get documented in particular ways, we might be risking our stability as immigrants in the United States. As well as I was growing up, I often asked questions the questions I named earlier to people, professionals in my network. I knew early on that I wanted to do work within mental health spheres. And so I had carved out a career early in my life where I was working within psychiatry and psychology. And so working with professionals, trained professionals in those fields, often asked, how can I get help when my brother is in crisis? And one of the things I was told was to call in police, naming that my brother is an emotionally distressed person. Now, I never did that. As you can imagine, having learned from that earlier experience when I was 13, I realized that calling police was never going to get me the help. And I named the emotionally distressed person acronym here because I want to come back to it. It's going to be a significant part of my talk later. So this is really my early life and the experiences that brought me to the work that I do now and to the work of abolition specifically within my public health practice. And so before I go forward, I wanted to ask you all to interact a little bit in the chat. What images come to mind for you when you think of safety? And I ask this because safety is the question that's really guiding, the pursuit that's really guiding all of my work. I want to be safe. I want my family to be safe. I want my community to be safe. And so I want you all to just drop some images that you think of when you think of safety into the chat. So just to read what some folks are saying, I see snuggling with my cats, community care, being around my loved ones, thriving, being in community, home, healthy environments, and opportunities for all, being protected, a warm sky, ability to move in my neighborhood without harassment. So I want us to just remember some of these items that we raise and remember the places and the experiences that make us feel safe, because I'd like to return at the end of this presentation to that discussion of safety. And you can feel free to continue interacting in the chat if that's stirring you, but I'm going to move on a little bit to a little history. Before I dive in to abolition for public health, I really want to begin with how we even got here and take us back a little bit to the beginning of the mental health system in the United States. So in 1773, the Public Hospital for Persons of Insane and Disordered Minds was established in Williamsburg, Virginia. And this is the beginning of the asylum era of caring for people who might not fit society's norms around behavior. And that era of asylums really dominated for a long time until around the 1840s and 50s when we entered a reform era. We had people like Dorothea Dix, who's featured here, and many of you might already know her name. She's an educator that advocated for more humane conditions in asylums. Her advocacy helped to propagate psychiatric hospitals because she really believed that people with mental illness could be cured if they were given the right care. And so one of the things that she was trying to do was create new institutions that were different from the asylums that actually can care for people and possibly even cure them so that they can reintegrate into society. Now, at the same time that Dorothea Dix's reform advocacy was happening, this other person featured here, Elizabeth Packard, was being institutionalized in a reformed institution. Packard was committed by her husband to the Illinois State Mental Institution when he felt one day that her behavior was making him uncomfortable. In her account of the episode, 2 physicians came to her home, took her pulse, and then declared her insane. She was admitted and confined for 3 years. And upon her release, she led a successful campaign across the country to change laws to safeguard people's rights in the hospitalization process. Her advocacy gave us some of the protections from involuntary admissions that we have today. She believed that her most troubling symptoms of the nervous system emerged really from a time when she was 19 years old and had contracted an infection which caused high fever, and her father actually had her confined for treatment. And she thought the trauma of being in an institution, just being in a custodial institution was worse than the actual fever and infection that she had. And this is all giving rise to the nervous system conditions that led men in her life to really determine when she can be confined. And so Packard's movement really gave us some of the rights we have today around our right to consent to being admitted to any kind of care. In the 50s, we started to see, or the 60s, 1960s here, we started to see the beginning of the anti-psychiatry movement. Many scholars posited that mental health diagnoses at this time were being used for the purpose of social control. Thomas Szasz, who wrote The Myth of Mental Illness, wrote that it is conceivable, of course, that significant physiochemical disturbances will be found in some mental patients and in some conditions now labeled mental illnesses. But this does not mean that all so-called mental diseases have biological causes, for the simple reason that it has become customary to use the term mental illness to stigmatize and thus control those persons whose behavior offends society, or the psychiatrist making the diagnosis. And so Szasz is making a claim that mental illness is not real. It cannot be real, he says, because it's really being used as a mode of control for people who just don't fit the norms. Another scholar, David Cooper, similarly noted that the violence perpetrated by people diagnosed schizophrenic at the time was no comparison for the violence of psychiatry, insofar as the discipline chooses to refract and condense on its identified patients the subtle violence of the society it too often represents. And so we're already getting some of this thinking around the use of psychiatry and what is a healthcare system ultimately to control and exact violence against the communities. And so at the same time that the anti-psychiatry movement is happening, there are pharmaceutical discoveries that start to really foment a movement for deinstitutionalization, which is the beginning of a movement to get people out of the state-run psychiatric facilities that had been so hard won in the 1800s, because the conditions there were still inhumane. And so there are three primary drivers of the movement for deinstitutionalization. One is the inhumane care. There was this belief that if we just deinstitutionalized people to community centers for care, then they would actually have access to more humane treatment. There were pharmaceutical discoveries that really invoked a hope that we could cure mental illness using medicine. And there was also, of course, money, as there always is money. The state just thought, and the federal government just thought we could save some money if we closed institutions and allowed for the care to be delivered in community settings. The establishment of Medicaid at this time excluded the treatment of people in institutions for mental illness. So it incentivized states also to close state-run long-term facilities. This actually moved long-term care for patients out of government facilities and into privately run facilities where profit was the primary goal. And so we see the result of that profit-driven care today in the fact that most people can't access it. It really benefits those who can afford it, leaving the poor and those who are really struggling with the most profound conditions without options often. And then I want to note this book called The Protest Psychosis. Psychiatry became really involved with the civil rights movement, and particularly with silencing the voices of civil rights leaders. It became a weapon of social control, says Jonathan Metzl in this book. And really, that was carried out through the change of diagnostic criteria for schizophrenia that was made during this time. So the DSM-2 was released, and schizophrenia, which was primarily a white woman's disease until that point, became a Black man's disease. Looking at chart data between 1960 and 1970, this chart on the left here, Metzl found that terms such as hostile, aggressive, and dangerous were more often ascribed to Black men diagnosed with schizophrenia when compared to white men. In a recent article, Metzl who has continued to follow this work, said that his book really understated the problem. In a follow-up study, this chart on the right is taken from the most recent study, Metzel examined articles published between 1949 and 1980 and highlighted that the problem of racism and diagnosis was created a relationship between race, mental health, and criminality. He examined two groups of articles. One group of articles examined the relationship between schizophrenia and race as a factor, and the other group of articles did not look at race at all. In his findings, when race was a factor, diagnosis was more often behavioral when compared to articles where race was not a factor. So it was more emotional in sort of emotional indicators of illness when race was not a factor in the study. He concludes in this most recent study that the findings suggest that DSM-2 indeed provided language to pathologize Black political protest and aggression in the 1960s. A key lesson of history is that the race-based overdiagnosis of schizophrenia in Black men was as much a consequence as it was a symptom of larger structural ills. In a broader sense, overdiagnosis ultimately resulted not solely from the attitudes or biases of clinicians, but from a series of larger political and social determinants. These efforts criminalized the protest for Black liberation and used the discipline of psychiatry to silence Black voices in the civil rights movement. The result was an intersection of a mental health system and the criminal legal system, which is something we're still experiencing today. And so as we continue through the decades, budget cuts to mental health care since deinstitutionalization have degraded an already weak system, creating a revolving door between jails and hospitals for people with serious mental illness. Those most impacted were primarily Black and brown people and those who are poor. And so it's really targeting people who already are so disenfranchised within society and are targeted because of their race within our society. The trend is sustained today to the detriment of Black and brown communities. In 2022, the New York Police Department, and I live in New York, reported an increase in violent incidents on NYC subway system. In response, the city deployed more police to respond to the crisis. City government added 1,200 NYPD overtime shifts every day designed specifically to increase the number of uniformed officers on patrol on platforms and trains. Funding for an additional 1,200 shifts per day would result in over 10,000 more patrol hours every day. Data at the time showed that there was a sharp increase in the number of emotionally disturbed persons arrested. 23.4% of individuals arrested had emotionally distressed histories, an increase from 2017, when the statistics were only 14.9% of those arrested having an EDP history. This proportion was even higher when restricting to arrests related to subway incidents. At a time when the world was reeling from a destabilizing pandemic, when many lost their jobs and housing insecurity had skyrocketed in NYC, the response was to increase policing and cut budget for the services needed to ensure that people were safe and secure. I want to recall here that when we talked about safety and security, nobody actually said more police in my neighborhood make me feel safe. Everyone talked about being able to walk unprovoked in their neighborhood or being able to experience the open air and the skies. And we all know that the presence of police can actually constrain those experiences and make them challenging experiences. And in fact, the data shows that when police is present, it makes the conditions worse for a community. Police response to someone in distress can be violent, sometimes resulting in the death of an emotionally distressed person. So you can imagine that when I was told to call police and my brother as an EDP, if there was a crisis, I had a significant amount of fear. And to this day, I still live with a significant amount of fear every time my brother leaves the house or walks out in the neighborhood. And I think if someone thinks him too strange today and calls police, this could be a very dire situation. And even if the physical body is not at risk, there is abundant evidence of the psychological harm of exposure to police. The study I'm citing on this slide examined the relationship between police brutality and mental health in Black adults. Both police brutality and heightened vigilance were associated with depressed mood and generalized anxiety. Heightened vigilance explained 11% of the total effect of police brutality on depressed mood and 21% of the total effect on generalized anxiety, which is to say that when police are present in a neighborhood, people become much more vigilant or aware of their surroundings. And that is causing an increase in stress, which is leading to effects on mood and anxiety. This effect can also be enduring. Sorry, skip the slide. Jails and prisons are also implicated. It's not just police presence in neighborhoods. Jails and prisons hold many people who have significant mental health care needs, becoming proxies for the state mental health care facilities that were closed with deinstitutionalization. But they're not designed for caretaking. Yet, for many Americans with mental illness, their first encounter with mental health care is within the carceral system. Looking at some of the statistics about jails and prisons, there are 3 things I want to highlight on this slide. The proportion of people in state prisons who have been diagnosed with a mental disorder is 43%. 25% of people in jails report experiencing serious psychological distress. And 66% of people in federal prisons reported not receiving any mental health care while incarcerated. So the carceral system is really not a good proxy for a robust mental health care system. As well as the last bullet on this slide highlights, there are long-term effects of interactions with the carceral system, including post-traumatic stress disorder, anxiety, and impaired decision-making. Extending that a little further, in 2016, the Treatment Advocacy Center wrote that the reality that an immeasurable number of people with treatable diseases only get treatment when they get sick enough to commit crimes that send them to jail, and then a forensic bed should be a source of national shame and an outcry for reform. I would even add here, actually just modify what the Treatment Advocacy Center said, and to say that instead of reform, we should really be thinking about how we abolish these systems altogether. As well, I hear echoes in this writing. It was one of the reasons I picked the quotes about an advice that I was given, which is that my brother should first harm me, and that is to say commit a crime, before I can get help. And so the fact that we wait until people who are in distress commit a crime, and we can also debate the power of who decides, the power dynamics within criminality and who gets to decide what is criminal. But all of that just compounds the argument for me that we need to really abolish these systems and get it out of any kind of healthcare system. The number of state-run hospital beds for adults with serious mental illness has been declining and has reached a historic low of 36,150 beds in 2023. A majority of those beds, totaling 52%, in fact, are occupied by people who have been committed to the hospital through the criminal legal system. And so we have established by this point that deploying police to deal with people in emotional distress can do more harm than good. And yet the carceral system has become a primary point of entry to a grossly inadequate mental health care system. And finally, people with mental health needs who are interacting with the carceral system often are not receiving the care that they need. The carceral system simply is no substitute for a robust healthcare system that centers human dignity and care. And I've grounded this presentation in the relationship between the healthcare system and policing via mental health, their entanglements in responding to people in mental health crisis, because that's my personal experience. But also part of my personal experience is that I'm a public health practitioner and professional. And so I want to just elevate one slide from that part of my experience as well. During the height of the COVID-19 pandemic, I had another opportunity to witness the harm exacted on communities when police are entangled in health matters. This map shows the density of public health and nuisance arrest rates by zip code in NYC. The darker the blue, the higher that density. Neighborhoods with the higher concentrations of Black residents had 56% higher rates of public health and nuisance arrests based on this study. This racial disparity was also strong for COVID-19 specific criminal summonses. Further, the 2011 zip code level stop and frisk rates had stronger associations with the public health policing outcome measures than indicators of poor social distancing compliance. And yet we saw that Black people experienced higher rates of COVID-19 related morbidity and mortality. So the police presence in these neighborhoods did not protect anybody. And yet we have so many stories of people having to go through police in order to get to necessary resources for managing their exposure to COVID-19 during this time. I remember distinctly at this time a colleague of mine sharing that she wanted to enter Walgreens to buy tests, but police were at the door of the Walgreens enforcing masking. And yet everybody walking into the store was masked. Many people understood their vulnerability. But because this was a predominantly Black neighborhood, the police presence was there. So I want to take a pause here. I'm going to take a sip of water, but I also want you all to go back to the chat and interact again with each other and with me. What are some examples you can think of where policing was used in a matter of health? And I might even extend this question to not limited just to health, because I don't want it to just be when public health use it, but there are ways in which there are a lot of things that we do in order to access resources and opportunities that promote our health. And so what are ways in which police are deployed and limit our access to those resources and opportunities might be a better question for us to interact with in the chat. So I'm going to name here that one of the things that comes up for me, protests and rallies. Thank you, Elena. Those are activities that are public health, in my opinion, too. I also think back to the HIV AIDS epidemic and the ways that police were deployed. First of all, that was criminalized, and then people were arrested for things that were matters of health. Police called for overdose response instead of an ambulance. Yes. Police posted at clinics and hospitals. Thanks, Lauren. Great. And you all can feel free to continue doing, to interact and share some of these examples, because there are a lot of ways in which police are deeply entangled in our everyday lives, and it actually limits our opportunities to secure our health and well-being. Okay. So if police don't keep us safe, then who does? I think this is an opportunity for public health. Until now, public health has largely leaned on its police power, and this is endowed within the public health sphere through the Constitution, right? As practitioners and as policy-making institutions who have to carry out the mandates of protecting population health, we actually have the right in our field to lean on police power. But what does it look like when we lead with people at the center and lean on people power in the creation of the public's health instead? I think that that's the primary question that I'm sitting with, and the reason that I am such a proponent of abolition. This question about how we actually keep people safe and protect human dignity is at the root of abolitionist public health. The fundamental problem within our systems now is that there's no access to the resources, including food, housing, employment, education, and other resources that actually keep us healthy and keep us well. And in reality, policing does not solve any of these problems. So we as a field have to reimagine public health to create the society we deserve. As Ruth Wilson Gilmore's quote reads, as an abolitionist scholar and oh, sorry, I'm like reading the line. So she wrote, abolition is about presence, not absence. It is about building life-affirming institutions. And so then the work of abolition is twofold. It's not just about taking apart what doesn't work. It's also about building what does work. We're talking about a shift from policing as a public health power to a public health centered on human rights. And this begins with problematizing policing altogether. One study or commentary that was published recently notes that policing is a public health concern because it's a tool of racist and discriminatory power, which we have demonstrated in our review of the history in our presentation. Policing is a matter of public health because because criminalization and punitive responses to social problems reproduce the social and economic conditions that result in criminalized behaviors, which again comes back to questions about who gets to determine what's criminality, and the fact that oftentimes these systems reproduce the very things they say they're trying to control because they actually don't take care of the root of any problem. A fundamental tenet of abolitionist public health is developing and implementing interventions that tackle the interpersonal, social, economic, and political determinant of health at the root of societal problems. And so that requires that we defund the police and reallocate funds to the primary and secondary preventative policies aligned with social determination of health. And finally, these writers put forward a call for support and creation of alternative systems that center collective care and well-being and nonviolent public health rooted in transformative practice. Now, the authors of this presentation are from the UK, but I think that these fit no matter where in the world we live, to really start to examine our relationship to policing and create a society that actually protects all of our health. And so I want to bring this all back to the title of my presentation. I call this presentation Unraveling the Blanket. I once heard somebody say, and if anyone knows how I can credit this, because I don't remember where I heard it and I don't know who to credit for it, but someone said, you know, the work of social justice is like unraveling a blanket, where the unjust systems that currently create our conditions are dismantled. So we're just pulling at our thread. If all of us pull at the thread in whatever it is that we do, then ultimately all the threads come apart and we unravel the blanket. I would extend the metaphor a little bit to include the work of knitting a new blanket that's warm and big enough for all of us. We have an imperative as a field to protect and promote the health of the people. In tracking the data on police involvement in the public's health, we see that policing has a detrimental effect on health. And so therefore, it's our responsibility to abolish a system that does harm to the people. This is a necessary part of our imperative if we are really protecting and promoting the health of everybody we serve. I've used the word abolition repeatedly throughout the presentation. And so before I reach any type of conclusion within the presentation, I think it's important for me to define it clearly so that we can start to think concretely about what we have to do to abolish policing within our systems. So abolition to me is tearing down harmful institutions and building systems that keep us safe. This means defunding the police and investing in community to go hand in hand. Eliminating prisons and implementing community solutions for accountability when people are harmed. Excuse me. And lastly, demilitarizing and returning land to Indigenous populations to create pathways for self-determination. That to me is the work of abolition. The enduring question for me since my childhood is how to keep my entire family safe. The pursuit of safety is liberatory work. It is abolition. I learned that night when we went to the police decades ago, that the police could not keep me safe. And in the years since, I've not found a single moment when police was a complete answer to the questions I had at the time. To recall, my question is, how do I keep everybody in my family safe? And what kind of support exists for families like mine? The answer is we all actually have to care for ourselves, and the support that exists is within our community. My mom and I have made it a long time taking care of my brother. We've been really fortunate. My mom has been able to have secure and steady employment for these last few decades when she's had to care for my brother. And in becoming an adult, I also have been able to go to school, get an education, get secure employment that has allowed me to also be a sibling that can care for my sibling who's in crisis. But this isn't the reality for many families like mine. And so my work is really about trying to ensure that nobody ever has to experience what my family experienced in those early years of my life. And so therefore, the pursuit of safety for me is liberatory work. It's about us all being free to walk our neighborhoods safely and knowing that everybody that we love can live with dignity. And so as a public health professional, I'm making it my mission to bring abolition to everything I do in service of creating a world where I can be safe, my brother can be safe and live a dignified life, and my mom can have the security that her children, whether disabled or not, will be well. And to me, wellness is not a condition of mind or body. It is the condition of society. It is the ability of society to take care of the people who belong to it. Public health detects often the wellness and unwellness of the society, and our society is not doing well by any measure, largely because we use policing and punishment so much. The more the care of our people is entangled with policing, the worse our outcomes. If we do our part as a field to abolish policing in the promotion of the public's health, we will get one step closer to creating a world where we are all safer. We'll be one step closer to unraveling the unjust blanket and knitting the blanket that keeps us all warm. And this blanket has particular elements to me. The threads include universal basic income. Everyone should be secure and know that they can thrive in the society. They can have access to the financial resources to live within the society they live. Secure housing. I don't believe that anybody should actually ever have to wonder about where they lay their head at the end of a day. Guaranteed access to food is a human right. We need food to live. And so food should not be a commodity that's traded and that is so heavily affected by inflation that it limits whether some people can eat. Employment, mostly because people, I believe, fundamentally have a right to create and to contribute to their society. They have a need to, not a right. And so therefore employment should be a right and something that's secured for everybody. Education, community, which is to say that all of these other things I've listed allow people to be connected and in community with other members of society. I also want to elevate that land sovereignty for Indigenous people and care for the planet that we call home are all part of abolition and securing a better future for all of us. All of this work to me is the work of public health. We are actively creating the conditions necessary for us all to be well. Ooh, skipped ahead a little bit. So before I close, I'm at the conclusion, and thank you all for bearing with me now. I've talked a lot. I want to offer a little bit of a vision. And I'm borrowing from Mariam Kaba, because Mariam Kaba has a brilliant imagination and has offered us in a short story called Justice, a Short Story, a vision for a world that we can start to build toward. So in the story, there's a character named Addie, and Addie lives in a place called Small Place. A visitor named Evie, who is from Earth, visits Addie's family in Small Place. And Evie has some pretty confusing questions for Addie. So I'm going to read an excerpt, which is Addie's response to Evie's questions, and leave that as a vision for us. I was so confused by Evie's questions that I kept the dictionary tab on my computer open. I looked up words that I didn't understand, like fear and stealing. I read the definition of fear as an unpleasant emotion caused by the belief that someone or something is dangerous, likely to cause pain or a threat. This definition led me to look up more words like dangerous and threat. While I was searching the web, I found a story called A Folk Tale about how people on Earth address conflict and harm. Basically, it goes something like this. While swimming across a pond, Sis Goose was caught by Brer Fox, who in some versions of the story is a sheriff. A sheriff is a police officer, in case you don't know. I had to look that up too. We have no police in Small Place. Anyway, Sis gets pissed off because she believes that she has the right to swim in the pond. So Sis decides to sue Brer Fox. But when the case gets to court, Sis Goose looks around and sees besides the sheriff, who is a fox, the judge is a fox. The prosecuting and defense attorneys are too, and even the jury is comprised entirely of foxes. Sis Goose doesn't like her chances. Sure enough, at the end of the trial, Sis Goose is convicted and immediately executed. The jury, judge, sheriff, and the attorneys all picked at her bones, which seems even crueler. The moral of the story is this: when all the folks in the courthouse are foxes and you are just a common goose, there isn't going to be much justice for you. I worried about this place called Earth and decided that it must be a terrible place to breed such scared, mistrustful, and cruel people. I was glad to be living in Small Place and resolved to keep my distance from Earth. At dinner, Evie's resumed her relentless questioning. She asked where all of the criminals were housed. When we stared blankly, she became agitated and yelled, the bad people, where do you put them? My mother said that there was no such thing as bad people, only people who sometimes did a bad thing. Our visitor laughed bitterly. Okay, then, she said, where do you put the people who do bad things? Finally, I spoke up. We don't put them anywhere because we all do bad things sometimes, and through our relationship with each other, we acknowledge the harm we've caused, and then we do our best to try and repair it. Evie looked at me like I had grown another head. You have no prisons or jails? No, was our collective response. And I am always reflecting on this when I think about the world that I want to create through my work, and what I would ask that we as a public health field do is to create a world where fear, danger, jails and prisons are foreign terms that we cannot even recognize. And perhaps we have to consult a dictionary from some time years prior to actually even understand what those words are. And as we are here at the end, I want to acknowledge that Palestinian liberation is also public health, especially as part of a global health practice. We need to demilitarize, and we need to cede land back to Indigenous groups. And I recognize that today, all across college campuses, as I'm speaking with you as part of a college presentation, as part of a presentation at a college, that there is activism all across our country at educational institutions in service of Palestinian liberation. And earlier, some of you raised that police being deployed to protest is actually one way in which police are actually entangled within our systems and limit our opportunity to self-determine and secure our own health. And so the cause of Palestinian liberation is very much our cause as well. And really, really concluding, I wanted to share a poem. So when I'm not just reading and getting familiar with what the data is out there, I'm writing and being a creative myself. And so I wrote a poem. It's a first draft, so please forgive me if it's not the most elegant poem I've written, but I want to share it with you today, just following what I just offered about Palestinian liberation. I sat down, bogged down, jumping from Facebook to the Times. I pick up the sacks of my humanity. Scattered on screens as I scroll past headlines, children dying. If I read, I'm frozen. If I scroll, I'm beholden to the murderous empire that kills my kind, to fuel my life of prosperity. Isn't this what it is to prosper? Teetering on the edge of everything, having everything while not quite having anything. Always 10 steps behind, racing to catch up, just move a little faster, push a little harder, keep going a little longer. But the children and the adults, bodies laying in shallow graves by people who just keep going a little longer. Maybe tomorrow, a ceasefire. Maybe tomorrow, a reckoning. Maybe tomorrow, a breath. Maybe tomorrow, a break. But today, broken hearts, broken lives. How do I live this moment, bogged down by sacks of my own humanity, packed away so that I may rise to live another day to serve? And that brings me to the end. One of my favorite authors is Arundhati Roy, and Arundhati offered this quote in her book, Capitalism, A Ghost Story, that says, another world is not only possible, she's on her way. On a quiet day, I can hear her breathing. And I have to believe that you and I and all of us who are working in service of abolition are really creating that world and calling her in so that she does arrive quickly. Thank you all.
You're getting so much love in the chat, in case you don't see it.
Thank you. Thank you.
Claps and everything.
Yay.
I'm also thankful for you sharing with us today. I could actually feel my body tensing up because of what is happening on our campus today. And so I just want to recognize for folks in the space that today, the events of today, it can be very triggering. It feels like, 4 years ago. It's just a lot happening. And so I am thankful for your words, Lisa, and your guidance and what you've shared today.
Thank you all for having me.
Yeah. Are there other folks in the chat, or you can also come off mute if you want to. If you have questions for Lisa, who again is a public health professional and has done work in a lot of different spaces, would love to have any questions or comments.
I see a question here about reform efforts. I think that's a great question. I really am not a believer in reform. I don't think that we can fix policing. There's been a lot of documentation already about the root of policing, so I don't have to rehash that. But for those who might not have seen anything, you know, the foundation of policing in the United States is rooted in bringing African-American folks who had been escaped their plantations back to the plantation. And so that is a very racist origin story, right? It is very much the story of restoring oppression and reinforcing oppression. And I don't think we can fix an institution that begins there. It's going to continue to reproduce what it or do what it was intended to do. And this isn't just about our police departments. I think we have to examine all of our institutions this way. The child protection services agencies that do so much harm to our families are rooted in similar principles of oppressing and keeping families torn apart so that they can be in service of the broader capitalist objectives of the empire. And so I think when we start to analyze and follow the historical trajectories as well as the money, we start to understand that there's no way to fix what we have. I think we have to just start building something new that works for us.
Heard and felt. Thank you. I have a question for you. Because you shared a poem, and I know you, at least I saw you had attended the talk with Dr. Pedway. I wanted to get your thoughts on the work or the place of art and artists in the broader work of public health.
Yeah, I have to say, Dr. Pedway's story about writing poetry and then becoming like entering academia and feeling like there was no space for my art within academia and really returning to it was inspiring and so resonant with me, because I feel like I've spent a lot of time thinking that I can't I can't be creative in academic spheres. I can't be creative in my professional life. It has to be this hobby that it's outside of my day-to-day life. But I really think that art is the only way to inspire a vision for the future. And so in any sort of practice where we are trying to create something new, we need that inspiration. And so like Dr. Pedway, I believe that art is firmly a part of a new public health practice or a public health practice going forward, where we are trying to create something that doesn't exist anymore and to break with the old ways of being.
Love it. So I just want to quickly share with the audience that we ask that you fill out our evaluation. Every time we do these, it keeps getting better and better because partly because of the feedback that you offer to us. And so please take just 2 or 3 minutes and click that link and fill that out for us. Lisa, if people would like to get in touch with you, what would be the best way to do that?
I can drop my email address in the chat, and if folks want to do that, I'm happy to answer any questions. Oh, I think I sent it only to panelists. Let me send it to them.
Oh, yeah.
So that folks can see it.
We have a chat just for like the hosts and panelists and
Yeah,
the general one. So we just have to make sure we use the right one.
right.
So with that said, this is actually the closing event for us for the year as we move towards commencement. And so I'm so thankful that you got to spend some time with us today. And I would encourage our audience to continue to keep in touch with Lisa and also to continue to grow in knowledge and wisdom, particularly around justice, equity, and abolition in this case. And so thank you all for attending. I really appreciate it. Take a breath, and I hope to see you soon in the future. Have a great day.
Thank you.
Bye.
Bye, everyone.